Namaste to one and all present here. It's a great privilege and a pleasure to participate in AYUSH Samriddhi International Conference Series. I'm greatly thankful to Dr. K.K. Pandey sir for giving me this opportunity. In the present scenario, infectious disease pose a substantial challenge to the public health system, but still, burden of non-communicable disease is also escalating. Exacerbating these issues because people have multiple chronic illness, lack of awareness, and insufficient health care, and drastically change lifestyle and the dietary patterns. Among these, cancer, autoimmune disease, allergic diseases, cardiac failure, liver failure, neurodegenerative diseases, metabolic dysfunctions are the major cause of concern. Later, it leads to advanced conditions which is very difficult to cure. These conditions are life-threatening as well as decrease the quality of the patient and their family members, because usually the treatment doesn't respond to the treatment and they end up in the chronic terminal illness. Currently, in India, around 1,000 palliative care centers are available, but compared to the population, only 1% of people, those who get the access for the palliative care. India still need to be more advanced in different states. Now at present, we can think about two states which is doing very good. It's Kerala and Maharashtra compared to other states. But I'm still, the same time, I'm very happy that AYUSH is contributing in a good way for last 3 decades. Palliative care needs a customized holistic care of the people suffering from terminal illness. It aims to improve the quality of the life of the patient and also lessen the suffering of their loved ones. It doesn't replace active treatment, but it is ethically very important for the healthcare professions to alleviate pain, sufferings, whether it's a physical, it's a psychological, irrespective of disease and condition, can be cured. Let's see what Ayurveda thinks about the terminal illness. It happens when the toxins have reached deep into the system. It is not a particular disease, it's a particular condition of an individual. We can call it as any name. It's a Kshaya, either it's a chronic wasting syndrome, or it's a tuberculosis, AIDS, cancer, or an emaciation state. Ayurveda describes them as a malconsumption because it occurs when disease completely runs the individual by consuming the person. Here, malconsumption means here the dhatu portion is not happening and gradually the toxins are loaded everywhere in the system. Example, in a chronic condition where we talk, all the dosas, all the tissues are affected. So malconsumption is a condition where the person is alone. There is no improvement at all in the patient's individual. Let's see why this malconsumption, or we can say dhatu agni kshaya, or why this dhatu paka happens. It happens broadly, we can think in categorized 2 ways. Either it's a out point of view of ahara, or it is a vihara janita. Ahara, when we doesn't follow the classical method mentioned, the Ashtavidha Ayatana, what is mentioned in the classical text, when we don't follow that, like example, when we overeat, adhyasana, over nutrients, irregular time, kala, yoga, matra, and then viruddha annapana, when we do all this, then because of indulgence of improper diet, the toxins are created, undigested toxins are created, which fill the systems. Secondly, when we do excessive indulgence of excessive exercise, excessive sex, or like a fanatic fasting, use of tobacco, alcohol, some of the harmful drugs, we intoxicate ourselves along with our environment. Either it is a chemical, either it is a pesticide, either it is a fume or anything which intoxicate the environment. Because of that, our life forces get exhausted and our structural tissues starts to starve. This slide, we can see how the nutrients, excessive nutrients, improper diet makes undigested toxins, block the pathways. There is a Srota Sangha happens. After that, it blocks the further movement of the nutrients to the other elements and then gradually weakens the immune system. When we think about our activities, our environment, here the irregular practices like fanatic fasting, more than higher amount of exercises, use of drugs, also insufficient nutrients at the same time. It decreases the life forces, and then it allows the parasite to come to the body and colonize in the system and weaken the system. Once again, this is the same slide where we were talking about the erratic food habit, erratic lifestyle changes, which makes higher amount of toxins and makes the Srota Shanga, and then becomes a Dhatu Agnikshaya, and then starts Paka in Dhatu. Once Dhatu Paka happens, body weakens, system deteriorates, and then patient invites lot of infection, lot of chronic illnesses. Leading causes starting from the stress, obesity, diet, drugs, different viruses, age, environment, alcohol, and tobacco. The most common cases what we get in a palliative center is a cancer, heart failure, COPD, kidney disease, Alzheimer's, Parkinson's, and also ALS, such diseases. Based on the level of toxins, the treatment can be managed. If it is toxins are in the digestive tract, easily curable, we can go with some langhana, some aushadhi, we can give medicines to digest the toxins. When it is a gross level, we have to think about doing some of the shodhana chikitsa, which is curable, and also we can do the purification therapy. But when it goes to the very deep level channels or a subtle channels where we cannot separate the toxins easily from the body, then it becomes incurable. We have to think at that moment to do some mild purification or a pacification and basically palliation therapy. This treatment in Ayurveda can be planned in different stages. Like it's the first stage, think about doing langhana, pachana, deepana, drugs. When it is second, third, fourth stage, we have to think about shodhana chikitsa. But when it comes to the critical care or the terminal illness, we have to think about the palliative care. Palliative care can show improvement in the pain, attitude, balance, coordination of the patient, flexibility, strength. As much possible, try to speed up the recovery if possible in the patient. We have to follow all these methods. If it is a terminal case, the approaches can be different, or we can make a combination of any one or two in this. Either it's a rejuvenation therapy where we can give rasayana dravyas. We can think of doing the balance of the doshas to strengthen the patient, strengthen the disease, or strengthen the disease pathology. We can think about doing mild purificatory procedures. Very important, we have to work on removing the emotional cause of the patient when the patient is ready for it. Can a separate 7 ways approach: medicines which can digest the toxins, increase the digestive fire, appropriate drinks and diet, which is very important, exercise, oil treatments, sunbathing, exposure to fresh air. This diagram can show slightly samana. We can go with mild shodhana, go for pratyahara vihara, yoga, meditation, or soothing therapy. The terminal conditions can be addressed in a different issue level. Either it's a physical issue, emotional coping issue, or it's a practical or a spiritual issue. Physical issue, what we can see in the patient: pain, fatigue, loss of appetite, nausea, vomiting, shortness of breath, insomnia. This can be relieved with the medications using proper methods. We can go with the nutritional therapy, physical therapy, deep breathing techniques. If it is an emotional condition, then we have to think about how to address the depression and anxiety, fear in the patient. We need proper counseling. We need recommended group of people who are experts in counseling. We can hold also some family meetings. There are some practical issues. What usually patients are worried about their financial conditions, their legal worries. So such conditions, if it is an employee, the concerns will be a little different. We have to take help from the advanced directives who can help in the handling the practical issues. Have to think about the spiritual issues. This is very important. Whatever the patient believes, whatever the values of his moral values, we have to sense that, and we have to approach in that way so that patient is ready to accept it with the appropriate manner. These are the main areas where we have to work regularly day-to-day basis. That is the interventions we can use in a palliative care practice. One is we have to think about the artificial feeding and hydration. We have to think about wound care. We have to work on urine and bowel related issues, ambulation, some of the therapies, specialized therapies. We have to think about sleep management and pain management. Artificial feeding and hydration, which is very important to maintain a healthy status, or we can say not to deteriorate further. We have to maintain a proper hydration. So when the patient comes, sometimes they come with either a nasogastric tube, otherwise they come with the endotracheal feeding, where already gastrotomy procedure done, already there is abnormality in the gastrointestinal absorption, or any severe neurological condition where patient is not allowed to take food. So such patients, when they come with a tube feed, we have to think about the nutrition. Generally, the condition, it is given that 30 kilocalorie, the nutrition is supplied per kg per day is usually supplied to a patient. This quantity is fair enough. Usually what the aspect is that the micronutrients should go enough to the body so that patient will not lead to a deficiency state, and also they will try to balance the metabolism. Here, the big role what I feel Ayurveda plays is to understand the Agni and Koshta of the patient. Patient can be in a conscious state or a unconscious or maybe a delirium state, but we can also handle the patient by checking their how much urine output, how is the bowel evacuation, per abdomen examination, pulse examination. We can do nadi pariksha. Along with that, we can plan any medications which is good in digestive disturbances. We can give through the tube feed. Only the thing we need a recurrent method to clean the tube more frequently, and also the medicine should be well thoroughly prepared so that it will be easy to introduce to the patients. Whenever we think about feeding or hydration or the food, Ayurveda has a significant role in providing nutrition. Food satisfaction should have also health benefits. We have broadly described classically chapters we find in our all classical texts. We find in Vaisheshya Kalpana also, where a lot of Ahara Kalpanas are mentioned. That starts from a light form of a ahara to a guru form of ahara, which we can plan according to patient's dosha and also patient's koshta avastha. So it can be a kwatha, it can be a yusha, yavagu, shadava, panaka. It can be given to the patient. Manda and yavagu, those are the rice preparation with a different variation amount of heat is used, variation amounts of water is used, the consistency is prepared based on patient's digestive capacity. It can be introduced to the patient. If patient is good enough, we can go with Mamsarasa, we can go with Takra Kalpana, we can go with Raga Sadava. Also, we can use some of the Mantha Kalpanas. Raga Sadava is basically pomegranate juice along with rock salt and sugar is added to that. Mantha Kalpana hits a little guru, also slightly cooling for the patient. We can give in different combinations. Either it's a milk preparation, we can add sugar, meat soup, we can add some of the fruits. The main intention to give nutrition to the patient, which has also some health benefits. When we do the same time, if possible, also we can think of some of the herbs which can be incorporated while feeding. It can be either a Deepana Pachana Dravya or a Anulomaka Dravya, Vata Samaka Dravya. Patient's specific based on the symptom or the condition, we can think about either some swasahara yogas we can add in the yavagu, we can add brahmana dravyas which can do a great amount of nourishment to the patient. Then we have to think about the matra, how much we should give to the patient. At least the food, whatever we give, it should digest in 3 to 4 hours based on the patient's abdomen examination and the face expression, or if possible patient is talking, then it is good enough to decide how much matra give to the patient. Wound care, especially, we need at least properly, we have to do possible twice, thrice proper dressing to the patient. Acharya Sushrata explained very well the 60 types of Vrana Upakrama, where we can do lot of treatment for the Vrana. We can do Vrana Karma, lot of dressing procedures. We can do Vrana Dhupana, Vrana Ropana Chikitsa we can do based on the condition, what we see in the patient, either it's a Paitika type or lot of Kledas. Based on that, we can decide what dravyas we have to use. If it is a Kleda Nasaka, we can use Trifla, Panchavalkala. If it is more of Rukshata, we can think of giving some oils like Jatyadi Thailam. We can think of Nalpamradi. We can give up even Eladi coconut, Champurudi. We have lot of medication which has a good Ropana quality we can use in that. Along with that, we have to give some dhupana to the vrana, so that whatever bacterial infection or the higher amount of slough can be easily removed with the dhupana. Gugulu, Tagara, Vacha, Nimba, Trifala, Sajjarasa, this all can be used as a dhupana chikitsa. Also, we can use simple honey, few medicated oils, ghee in proper dressing. Along with that, we have to see the environment of the patient where it is lying, because he is using the clothes, the bed, everything has to be cleaned properly. And the clothes also can be dipped with some medicated herbs after washing, so that it can be made it into bacteria free. Also, the room has to be given proper dhupana with the gugulu, either nimba or vacha or shallaki, some of the drugs we can use and give the dhupana, so that his environment is free from bacteria. There is another concern about the urine and bowel issues. Like we say, when Vega Avarodha happens in the body, immediately Vata increases. We have to see that there is no Vega Avarodha in the patient. We have to work to remove Apana Vayu Vikriti in the patient. Once we can do Apana Vayu Vikriti, we can find improvement in the Samana Vayu and the Prana Vayu. So the patient will have increased appetite, have little breathing capacity, everything can be increased once we do avarodhana. We can remove the avarodha from the body. Here we can think of giving a lot of vasti, either it's a anuvasana vasti or a niruva vasti. Drug medications we can choose based our need. Either it can be a Sahacharadi Thailam, it can be a Dhanvantar Meligupakam, we can think of Nimavratadi castor oil, we can think of even Jatyadi, Murivena. This all can be used as a Anuvasana Vasti. Wherever needed, based on Dashamula, Irandamula, this all we can use with honey, rock salt, Shatapushpa, we can use a Niruva Vasti and can be introduced in the patient. It is, as we say, Ardha Chikitsa in the bedridden patient, it has a great role. It evacuates the GI, lubricate the GI tract, evacuate the urine, bowel. It and also it gives little vigorous or the energy to the person. Ambulation, because once the patient is not mobile much, not moving, not able to move properly, even in few steps, in those conditions, we have to think about how to make the person's the limb parts, we can see the at least the hand and leg movement is there always. So we can do some of the therapies. If they are doing physiotherapy, we can also incorporate with physiotherapy, if possible, light, mild yoga. Along with that, we can go with Snehan and Svedana Chikitsa, which can maintain the strength of the joint. Muscle tone can be achieved. This also will help at least to move the person to feel little lighter and energetic. And those patients are bedridden, they have a high chance to make complication in the bed sores, along with a lot of thrombosed formations, and also they become dull if they are not moving properly. So when we do Abhyangam, Sirodhara, Nasya, Karnapurana, Gandusha, Kavala, this all helps to make patient little more flexible, and possible they can be little vata can remove vata from the body. We can think of specialized Panchakarma. What I feel Vasti is the best treatment, which definitely we should do all the palliative care centers. Based the Basti, we are known to be anti-aging. It can improve good strength, Agni, complications, complexions. We can think of cognition power. We can think of quality of living. Everything can be partly improved. If the patient also in a tube feed, also we can think of, if patient is already on radiation, chemotherapy, also we can think of giving Vasti. We can give lot of therapy. Even we can give lot of milk preparation as a Vasti. We can think from a milk preparation to Mamsarasa to specific herbs. Even Yapana Vasti, we can give lot of variety of Vasti, which can strengthen the whole gut, which can improve the bacteria flora structure, which can take out the Vata and improve the quality of life of the person. Even we have seen in our classical text where Acharya Charaka mentioned about the Pichavasti, that the goat's blood is introduced in patient. very important, the sleep. If patient is not sleeping, it is very difficult to heal the body. Patient has to sleep in the night properly. We can do something which is very soothing for the patient, like light massage. We can give proper bathing to the patient. We can apply some oil massage in the head too. We can do regularly. We can give Anupama Amshadravya if the patient can digest. We can think of giving Shali Rasa with yogurt. We can give of Takra. We can give whatever the patient feels happy. Either it's a music, either it's a smell, aroma, anything, or it's a light sound. We can do also Netra Tarpana. We can apply some of the herbs on the forehead. We can apply on the head as the Talapudichal. We can apply. Also, we can do, we have to see that the patient bed is very comfortable so that he can have a good sleep. Very important, this is from the patient points of view, is the pain management. The terminal ill patient, they deal with a very intense pain, and also WHO has given a specified guideline how to maintain the pain in the person. But whatever the patient they suffer when they do Ayurvedic intervention, the intensity, frequency, and duration of pain episodes can be reduced. We can start from Abhyangam, Svedana, Snehana, Sirodhara, Vasti. All this we can incorporate during our treatment. And also we can see wherever the drug induced, either morphine induced, chemotherapy induced, patient have more intense pain or the constipation, everything can be handled with all these therapies. Here possible conditions, like we can see here, like how we can do the bowel management, if it is a neuropathy, if it is a chemotherapy induced pain, if it is a peripheral neuropathy. We can think about the oral hygienic, oral cancers. We can think about the nutrition aspect. We can think, and these are the formulation which day to day we use. Even more based on Yukti, we can add more formulations to our practice. And the procedures we can do all this, like Snehana, Svedana, Matravasti, Dhupana, then Nasyam, Sirodhara, Talapodichil, Gandusha, Dhanyamlam, Kshiradhara. All this treatment can be used for the patient. Through this traditional system of medicine, we can achieve a comfortable and a health maintaining status in the patient. Ayurveda can play a crucial role in various facets of palliative care, including diet, nutritional support, sleep management, wound care, pain management, mental health support, and immunity. In terminal illness, the patient is, that time it's not important to cure the illness, but the prevention of complications and prolonging the lifespan with comfort. Ayurveda system of palliative care helps to improve the quality of life. Thank you for your patient hearing. Thank you so much.